75-year-old male patient, had a previous deployment of the stent in the left main after it got slipped because of the very calcified stenosis. This is a BMW wire which we have put in the LAD, and this is an IVUS study which was made, which showed that the stent, a lot of calcification in the left main. The IVUS also showed that the struts to the left main were deployed, but a lot of calcification. This was the first wire which we used, which was a Vesteral wire or a BMW wire from Abbott, and the wire would not go, so we used a Conquest Pro. This is a Conquest Pro which has gone down the vessel, as you can see it, and then the laser was used. It's a 0.9 mm laser. Multiple lasings were done, and right at the distal left main and the ostium of the previously deployed stent in the left main, a passage was created with the laser. So that is the laser which has created the passage, and this is the laser which has gone about 1 millimeter beyond the strut of the stent. As you can see, multiple lasings were done, and this was after laser, and then some balloon dilatations were done with initially this is again the laser catheter, and multiple lasings were done. This was followed by a 2 millimeter balloon and followed by a 2.5 millimeter balloon, by which the struts of the stent were well dilated, and then we deployed 2 stents. This is the first stent, which is Alpine stent. It's a 2.25 by 18 mm stent. We have used a Guidezilla, as you can see, and the Guidezilla helped in advancing the stents, and that was the balloon dilatation with the stent balloon, and this was followed by the second stent which was deployed, and that was the final result. As you can see, this was the final result in the LAO caudal view. So 2 stents have been deployed after laser and after dilatation with NC balloons, both 2 and 2.5 balloons. You can see that distally a 2.25 18 and then a 2.25 12 synergy stent has been deployed. Excellent distal result. As you can see, the vessel is a big vessel. The patient tolerated the procedure quite well, and you can see the whole. So this was So this was the pre. You can see how critical the stenosis was, almost near closing vessel. This was the pre, and that is the post. So that's the post. Patient is perfectly all right. Thank you.